All right, good morning, everyone, or good afternoon, or good evening. I'm Wolf Kirsten. I am the President of International Health Consulting, and I'd like to welcome you today to the International Wellness Series, BRICS and Beyond, and this is actually our fifth session, or fifth part, and I'm very glad that today we're going to be focusing on the UAE, the United Arab Emirates, with a good practice case study from the company, telecommunications company called DO. As you know, a growing trend for today's corporations is to move towards becoming global. And with that, of course, keeping your employees healthy in different countries. And at the same time, we know that in various regions and countries of the world, there's quite a bit of growth in terms of proactive strategies, keeping your employees healthy and maintaining their health. Even now, the systems will be very different from the United States, as you will hear today. So, there are some encouraging signs, I would say, with growth, but the challenges are definitely still there. As you all know as well, the chronic disease challenge is massive, and you hear in the Arabian Gulf region, it's very pronounced. So we got a lot to do, I think. So I'm really excited that we can bring you this excellent and timely webcast today. And I should mention again, this webinar is a partnership between the International Association for Worksite Health Promotion, which I am the immediate past president of, and also the Corporate Health and Wellness Association, of course. So we're very excited about this partnership, and as I said, this is the fifth session, and we look forward to it. Before I introduce today's speaker, I just wanted to make you aware of the opportunity of asking questions. As usual, for those of you who've joined before, you will know that you type in your questions in the Q&A portion, and we'll browse those and cover, if we can, all of them, depending on time, of course. And I also should mention that today's webcast is going to be available about more or less 48 hours after the session today, and the audio will be combined with the video and then the PowerPoint, I should say, and then we'll email a replay to all participants. So you'll have that, and also for maybe your colleagues who didn't have a chance to join today. So, so without further ado, I'd like to introduce Dr. Mansoor Anwar. He is the Director of Medical and Occupational Health Services of the Emirates Integrated Telecommunications Company, actually better known as DO, DU. DO is really the fastest growing telecommunications company in the region, and has really made employee health and well-being a top priority in the company, which is very exciting. You will hear some of the innovative, apologies here, innovative approaches here. And I should say that Dr. Mansoor has really been one of the pioneers in the region in promoting wellness and health and well-being. And he's also a regional chair of with the International Association for Worksite Health Promotion. So thank you for your work there, Mansoor. And as you can see here on the slide, we'll focus on three main bullets, and then I'll hand it over to Dr. Mansoor. So first of all, an overview of kind of the health-related challenges that we're facing in the region. Then, of course, the value of investing in employee health in the UAE. As you can imagine, it's a little bit different, the value proposition than it is in let's say, Europe or in North America. And then, of course, finally, maybe the most important part, how DO has been able to make a commitment to employee health and well-being and really develop a comprehensive program. So sit back and enjoy, and I look forward to your questions at the end, and now I'll hand it over to Dr. Mansoor. Please, Mansoor.
Thank you, Wolf. Good evening, ladies and gentlemen. Assalamu alaikum, as we say in Arabic. I'm really delighted to join you all for today's webinar. It's my first experience and hopefully not the last. Thank you so much, Wolf and Daniel, for all the preparations and for all the technical setup. And I think it's going to be an amazing opportunity to indulge into a little bit of what we do in this region in terms of wellness. In summary, my name is Mansoor Anwar, and I'm a family doctor by profession as well as an occupational health specialist. I graduated from Royal College of Surgeons in Ireland in 2001, and then I pursued my career in the field of medicine and did my specialization. And obviously, I have to know about the concept of workplace wellness into greater detail in 2009 when I was doing my occupational health degree down in Birmingham. And since then, it really caught my attention, and I started figuring out more about this concept, and then I came to know Wolf and the whole team, and it's really exciting. So without any further delay, I would like to start my presentation today and take you to a quick tour through what we do here in the Gulf region and what challenges we have, what things we were able to reach. And I would like to thank again everyone who is attending at the moment and listening to us, and welcoming any questions at the end. So this is, as you can see in front of you, hopefully, the location of United Arab Emirates in comparison to the other countries. And we're located in the Arabic Peninsula, in the Middle East region, as part of Asia, and we're surrounded by a couple of countries such as Saudi Arabia, Oman, Qatar, and the 6 countries form the Gulf Corporate Council. So the interesting part about this region is that we have a lot of things in common in the sense of culture, in terms of religion, in terms of relationships, values. A lot of our family members have traveled into these different countries in the last 40 years for various reasons, and some of them have resided in these countries. So there is a lot of interrelationship as well in terms of relatives and having some family members here and there. So there is a lot of commonality in terms of our habits, our behaviors, what do we do, and how things evolved in the last 40 years in the region. This is again the slide which tells a small brief about the association of the 6 member states, which is the United Arab Emirates, Saudi Arabia, Oman, Bahrain, Kuwait, and Qatar. And in 1981, they have formed that council to have that kind of a common platform and have common service investments and other areas related to the different factors. When we come to health issues and risk behaviors, as you can see from this slide, this is one thing that we really have started facing in the last maybe 10 to 20 years. The challenge that we have in the region is what? I mean, we were based on sea, where the income was mainly on fish, on getting pearls, and so it was a very simple life, and it was based on the most important wellness cornerstone, movement. So everything was based on movement, whether the fishermen or any other kind of an activity which has been done in the region was a healthy activity until I wouldn't say if it was a good thing or a bad thing. The oil was discovered in the late 60s, mid 60s, and then things started becoming totally different. We have exponentially moved forward by, well, I would say, the speed of light into the new development and into the various aspects of the new life. With that, we got that very nice gift of poor diet, inadequate physical activity, tobacco use, and the resultant chronic diseases starting from obesity and going down into diabetes, high blood pressure, and the bunch of friends that like to go together as I like to tell them about. And all of this above is increasing and becoming costly threat to corporations and to their workers. The challenge we have is that population-wise, we are not met. So having this disease as a challenge is also a national threat. It's not just something that is a health risk only, because, for example, the percentage of Emiratis or the nationals in United Arab Emirates, we nearly just touch a population of 1 million out of the 5 million that are residing in the country, and the remaining 4 million are the rotating workers or the employee members who are coming from different countries for investment or for living or for making a living in this region. It might be a little bit different in Saudi Arabia or Oman, where the nationals might be more than the non-nationals, but at the end of the day, we have this main challenge. So it's a cost, whether on companies, whether on the life of people, and then brings with it all the impact in terms of healthcare services and the resultant reactive approach which is being done at the moment. Obviously, we know that research has shown that companies with a well-informed conscious workforce can lower costs. I'll come back to that later on. Some might ask, okay, why this happened? In 1971, when we had the unification of the country and some other countries who got their unification, and at that time, a lot of new laws started showing up. And then with the subsidy policy, which happened in the late 60s, that encouraged the intake of fat, sugar, rice, wheat flour, and meat. And with urbanization efforts, which was faster than the health education efforts, that led to that gap. People started influxing, started flooding into the country from the suburbs area, from the urban area, and this led to that kind of lack of coherence between the two in terms of figuring out how to be able to have a healthy living or how to cope with the new lifestyle. I would put it in a better perspective. Here is a very interesting table that you can see in front of you, and I have adapted this table from Wolf's recent book, The Global Perspective in Health Promotion, and it clearly shows how is the impact of the various risk factors. And this has been done, if I'm not mistaken, it comes back 5 years ago, around 2011 or 2010, these statistical data. And you will notice very interestingly is that the female ratio is always higher than the male ratio, if not in all of the boxes, at least in most of the boxes. And that was confirmed by another research which was done recently, a year ago in Abu Dhabi, where the highest at risk are the female, and especially the young female. And that by itself is something that, if it's not being taken into consideration, will lead to dramatic effects. And here I would like to add, initially we had a very low level of female workers in the various work sectors, but with the development, with the education spreading everywhere, now if you go to certain companies or certain government organizations, as a man, I think you would need to ask for your right, because the number of women in some organization is like 90% or 80%. So, and that's something very nice, is that this is the understanding of the various families which come from a different mindset 40 years ago, to be able to respect that and to have that coherence. But with it comes these challenges, which is we mentioned. Mortality scale. This is a very scary slide, and it shows that the number one death-causing reason is heart diseases. This might be very common to some other developed countries, but again, this is something that is directly linked to our lifestyle and to the decision that we make on a daily basis in terms of what to eat, how do we move, how much we really do in terms of physical activity and healthy diet, which are the two important steps. One thing that it's a pity to mention in this slide is the road traffic accidents being one of the major causes of death in this region. There are some different factors. One of them is that we have this multicultural society in the different countries in this region, and everyone has his own bag of understanding of the driving. But anyway, we can maybe discuss this in another session, but this is also an interesting area that can be looked into in terms of preventative aspects. So a couple of next slides, I might cruise quickly through them, and this is just kind of an intro about the workplace wellness history for those people who might come to this concept for the first time. In 1997, the Luxembourg Declaration has declared about that workplace wellness. It's been defined in the terms of combined efforts of employers, employee, and society to improve the health and well-being of people at work. So it's not just the employer's responsibility, and it's not just the employee's responsibility. It's a combined effort, and I think this is very important to be taken into consideration. Another definition: comprehensive analysis and design at human organization work level, aiming at development of health resources in the enterprise. And as you can see in front of you, this can only be achieved by improving the organization and the working environment, promoting active participation, and encouraging personal development. The declaration has mentioned a couple of cornerstone guidelines in order for it to be able to be picked up by any entity in any part of the world, and that can be only achieved by participation, integration, project management, and comprehensiveness. So the details we mentioned about each point, I will not indulge into it, but these are the manifesto of any workplace wellness guideline. Why do we do wellness? Is it something nice to do, or is it a trend, or is it just a new trend that's happening and that's going to fade off after a while? It's all, at the end of the day, what an employer is after. Number one is the dollar sign, if you think about it. Companies are being made there to make money, to make profit, and they want things to make sure that their workforce are productive enough and able to continue energizing the factory in which they are working. And in that perspective, productivity, absenteeism, presenteeism, insurance utilization, and all of these indicators are very important tools which can be used, obviously, to measure the effectiveness of a wellness program of workplace. But in another hand, these are tools which can also kind of, let's say, justify a workplace wellness agenda in any workplace. Nevertheless, I might be a little bit skeptical that to measure this indicator is not as easy as it sounds. I mean, in our experience, I'll go through it once I reach to the slides. It's been not as easy as it sounds, because with various factors, there are various other challenges. For example, for you to the yearly inflation rate, you have a healthcare provider which increase their rate on a yearly basis because of the commercial aspect of it. So it doesn't work out that if I do a number of wellness activities, then it will automatically bring it down. It needs a number of years to show the result. But in terms of engagement, it has a massive impact. Very quickly, I'll just mention some examples because I thought using this opportunity to be across the globe to give you some good example about some other countries. It doesn't mean that these are the only examples. It's just a glimpse of example, and then I'll go into our experience at do and what do we do there and what have been done. In Saudi Arabia, there is a very major, well-known oil company called Saudi Aramco. They've been there since 1940s, and they have started the concept of community health centers for their employees and their families. They have training programs in health, safety, environment for their contractors, regular inspection of contractor labor camps to ensure adherence to best practice, civilian system in place, individual counseling provision, and they did a landmark study in 2004 among firefighters, which led to comprehensive health and fitness program for the firefighters, as well as a small fitness center establishment of Aramco fire stations. So this shows that the commitment is there, the thought process is there, and to have supported physical environment is being taken seriously by some organizations. In Bahrain, there is another petrochemical company which are leader in health and safety, and they are award-winning entity, and they have established perfect kind audit system for safety issues, which is something uncommon in the region. Another company is Dolphin Energy, which is a joint partnership between Qatar and United Arab Emirates, and they have as well focused on strategy towards wellness and prevention of occupational illness, and they have an annual heat stress management program, which is something that we are famous of, having our temperature reaching to 50 degrees Celsius in the summer, and I think just 2 days ago it was around 45, 46, so that can explain it. When we come to United Arab Emirates, finally, I wouldn't say that DO is the only wellness advocate in the country. There are many other good examples that it would take plenty of time to mention them, but I'm really glad that we are among them. As similar to our story in telecom being the fastest operator, because we have been erected in 2007. Just a brief history, we have a telecom operator called Etisalat since 1976, and it was the only telecom operator in the country. And then the decision has been made in 2006 to have a competitor, another operator, in order to increase competition so that the customer will be the end beneficiary from this. Hence, the company was established and it started its journey since then. And although it started in 2006, officially early 2007, it started functioning and started selling out the numbers and the landlines and etc. Interestingly, starting in 2007, And me joining them at the end of 2009 is a great story. So within, I would say, 3 years or 2 years and few months, they requested me to join them to have a medical center in the company and to push the paddle for the wellness and the related factors. So this shows that the thought process was there. They had that belief from day one, and they were waiting for the right moment. And in the last 4 years, I'm very glad and I'm very thankful, number one, before anyone else, to our employees who really made this a huge success for these various wellness initiatives and programs, and obviously to our senior management. So if we will go into the corporate wellness and medical services at DO, in 2010, the first thing we did is that we established a medical center. It was made up of one physician, myself, and we recruited a nurse. And our main goal was at that time is to provide acute and chronic medical care for our employees within the working hour, although they have the medical insurance cover. And we started slowly focusing on wellness. Honestly speaking, we did not start harshly on them because we were reluctant. How would be the uptake? Changing the mindset is not something easy, especially that we are talking about 65 nationality working in our company. And coming with a new concept needs the buy-in. And if there is no buy-in, obviously that will lead to failure. So in 2010, which was year one of my presence in the company, in addition to having the clinic on board, we pushed on small wellness activities such as the smoking campaign lectures and a couple of health tips during the month of Ramadan, the month of fasting. We started sending health tip SMS on the mobile phone of every single employee and their family members to give them some nice health tips. And that kind of drew the attention of the employee. That's something new. That is something different. We were not aware about it before. And honestly speaking, that was like an eye-opener for them. And since then, we started pushing for more and more wellness activities. In 2011, we were able to have a kind of mini campaign, I would say, which stayed for 6 months, and we did a couple of various things. And that was the first year where we started the flu vaccine campaign, and that was another huge success. And again, it was something unusual in the country to have a flu vaccine campaign in the organization. People are used to go to the medical center or to the health center next to their house to get the vaccine, or to the hospital, but not at their workplace. So we made that available, and we made it available at a cost price so that they don't carry the burden of paying more than that. And in that same year also, we introduced the Global Corporate Challenge, which is, many people know about it, the Walking Step Challenge. And that also has got the attention of many of our employees, and we had an amazing participation of teams on that day, on that year. I mean, we had more than 200 employees participating in that competition. So once we came into 2012, we laid down wellness calendar. So as you can see, we were moving on a slow pace. And just bear in mind that while I'm mentioning all of this, the leadership support was always there. The top management, including the CEO himself, had a great belief on this, and he was always using any opportunity. If there is an annual gathering of the employees of the company or any other event, he will always mention the clinic or the medical facility by one way or another, because they took that as something which is part of the agenda, and they wanted also to push for the concept and inject it into the DNA of the company. And I think this is one of the main infrastructure for the success of any wellness program in the country and in the region, which is the leadership support. Why do I say that? In the country, we don't have a legal obligation to instigate the workplace wellness program or any workplace wellness initiative. It's purely out of corporate social responsibility and out of good image or out of best practices to go for such an initiative or such a mandate. I'll give you an example. Some of the other organizations where we used to meet up with them and they come to know that we have clinic in the company. You know what the first thing they would ask us? Oh, so you mean you have a lot of sick patients. That's why you have a clinic in the company. So you can see the mindset, they perceive it from a different angle because they assume that having medical centers, hospitals, clinics all across the country is more than enough to provide care. And not putting their mindset is that prevention is better than cure, which we tend to say, but we don't implement it when it comes to reality. 2013 was the big year. As that year, with the push and the support of our chairman, it was being decided that now we need to take wellness into the next level. We restructured the clinic into a wellness department, so then everybody knows that we have something called wellness department rather than a medical clinic or a medical center. So the concept is there in the structure of the company. And then the second thing he said, I need the CEO plus all the senior executives to have the wellness as part of their performance. This specific requirement, injecting wellness into the performance appraisal of the senior executive with a certain weightage against the end of the year, and in terms of that they don't reach with set targets, of course, and if the targets has not been reached, then this will impact the performance, has really meant a lot to us. It really meant that we are really on the right path. It might be a little bit skeptical to some people that wellness, health is something personal. Why are we pushing people for it? It's a very interesting point, but at the end of the day, we thought because we had laid down the infrastructure, we had picked up wellness from 2010 and it had reached the maturity, people wouldn't mind to go ahead and on the contrary, they will look at it into it as something positive because we told them that this obviously will have a positive impact on you and your health and your team members, but even we provided them with the supportive tools in terms of gym membership and healthy nutrition advice and consultation throughout the year. So the platform was ready to uptake such a thought process. Let me take you through the slides and tell you how we were able to implement these various things throughout our journey. Obviously, when we restructured into the wellness department, we had a vision and a mission to be the leader in incorporating a sustainable workplace wellness program in the region, and the mission to provide new employee means to increase and sustain optimal health so they can fulfill company objectives more efficiently and effectively. The word sustainable is very important for us, and this is one thing that I have found in many companies they fail to do. I used to work in the government of Dubai and hospitals and medical centers down in the government, being an Emirati for the last 9 years before joining DU. And I've always noticed one thing that we are famous at is to have 1 or 2 wellness activities in a year with a great PR and press release coverage. But when it comes to sustainability, it's done. We don't know what happened after that. We had great participation. Everyone praises the activity, but when it's done, there is no continuity. Okay, now what do we do? Do we have any indicators that we need to follow up on? Do we have any figures that we need to revise at the end of the year or the following year to see what we're doing right or wrong? This is not to happen. So we really emphasize at DU to implement sustainability as the main domain for any wellness activity that we plan or any initiative we plan to do, and that's why came the notion of the wellness department and the executive wellness. As mentioned earlier, to get a senior management support is something very essential, and this could be a good learning point for our other partners who are maybe joining us today from different other organizations within the country or within the region, that it is the senior management support that will really pick up the concept and push it further. And because, you know, you need that kind of a role model. If your line manager does that, you will start doing that. I'll give you an example. When one of our seniors mentioned to me that how to move forward, because now part of his appraisal is the wellness index. I mentioned to him the roadmap, and we agreed on it. And guess what happened the next thing? In a week time, his team members voluntarily came to us in the clinic and in the wellness department and requested us to create a roadmap of wellness for each one of them and have it in their appraisal. We told them, but it's not a requirement, it's just optional if you would like to have it. I mean, it's just for your team manager. They said, no, if it's on him, we would like also, then we can practice together and do so many things together. And even they were able to use the gym facility that we have. I'll come later on to some of the supportive tools that we have in the organization to help all of these things to happen, because obviously some of you might be thinking, okay, how do you push for this activity if you don't have the proper infrastructure? Anyhow, coming back to our point, then we established a dedicated wellness department, and we had a plan with proper points in terms of data collection, goals, implementation, budget, evaluation. It's a complete, full-fledged operational plan that we laid down. This is a nice slide that I like to show, and it just give you a graphical representation of the domains that we look into. Because in good enough organization, again, in the developing countries, wellness is defined as physical activity or a fitness center, let's say. In some other companies, when you say wellness, they will quantify it as healthy nutrition and healthy diet. No, wellness is a holistic approach. Wellness involves everything from your diet and physical activity to your clinical aspect, vaccination, your stress, your smoking. So it's a complete full-fledged, because one challenge we have done in the country is that a lot of vendors who has operated in the arena of fitness has used the word wellness interchangeably with fitness, and that made that kind of confusion. This is a very nice slide, and this is the, I like to call it the nightmare slide for our executives. This is where their KPIs for their wellness is being crafted. The things that we look at and we have agreed with is to look at their blood sugar, their blood cholesterol, different breakup, the LDL, the HDL. LDL is the bad cholesterol for those people who might not be familiar. The low density, and the HDL is the high density, the good one. And then the cholesterol HDL ratio, which is an important indicator that looks at risk of heart diseases in 5 years' time. We're using the Birmingham study. And we used the body composition analysis in terms of fat muscle ratio as an important and as a pivotal indicator to measure and to set up targets accordingly for our executives. And you can see there is the graphical representation on the left side of the slide to tell them where are they at the moment and what is their target. And by the way, these targets are reviewed every 3 months, and it's being tailored according to the requirements, because some of them might have back injuries, some of them might have knee-related issues. So we try to tailor it as much as possible to the requirement, and even to the level of activity that they're planning for. Some of them are mountain climbers, some of them are runners, so their requirements might be different. So we do take that into consideration. And it would be, honestly speaking, interesting to see the result of this at the end of the year, because for us, again, this is something that we are starting for the first time in terms of executive wellness, and it would be nice to know what happens in terms of the results. This is the wellness calendar which I told you about, and that is shared across the company. And this is just a sample of the calendar which has been developed in 2012. In 2013, we have something similar. And you can see that in different months, there are different activities. And again, we made sure to mix and match between diet, physical activity-related initiatives with clinical or health-related initiatives. We were among the first organization in the country to introduce cervical cancer vaccine in the company. And that was something which was unusual, because the vaccine itself has been just recently been approved, and in a country where culture and the various mindset is a bit cautious when it comes to female-related diseases, it was, I think it was a good success that we were able to get a good number of even of women who agreed to get vaccinated on that year. Healthy Back Month, you can see in one of the boxes. Again, we try also to tailor our wellness initiatives to the requirement of the employee. They do sit on the chair for 7-8 hours a day with the breaks, and they have to use the laptop, the desktop, and then using the muscles of the upper arm of the upper extremity. So they work to have that kind of a privilege to have the best way how to sit properly and the posture and how to prevent long-term back injuries. And in terms of International Days of Diabetes, no smoking and other events, we try to align that with the International Days of the World Health Organization, which they do publish on their website. And we try as much as possible to go in par with that, because then even a good number of other government slash private organizations in the country celebrate those days. So we don't want to be out of the crowd in that sense. This slide gives us an important aspect of how to make sure that your wellness program will succeed. If I have my senior management support, and if I have all the tools and all the enthusiasm and all the expertise, but if I don't have these sustainability tools, then we will end up to square zero, and we will have a nice one-time activity in a year, and that's it. The clinic, obviously, a fully equipped fitness center plus a swimming pool. We do have that in our headquarters. And guess what? Since we started our various activities recently, it's been used massively. Just last October, we have introduced the biggest winner weight loss challenge, and we got more than 260 employees participating in the event, and they lost a total of 500 kilos in a span of 8 weeks. That's cumulative loss weight they lost. And we used the gym. They used the gym like anything in those 8 weeks. And the good news is that we kicked off the second season of the weight loss challenge 9 weeks ago. And this week is the last week of the season 2 challenge. And hopefully we're going to announce the winner next week. So it's really exciting. Canteen with healthy options and healthy vending machines. We were able to collaborate with a couple of our vendors with fresh fruits and fresh salads to have those kind of healthy vending machines in the workplace. That is something that was helpful for people's use. Staircase area and elevator with motivational quote. I'll show you some examples of that. That's also another place where we thought we can use it to inject the concept further. Communication tools, obviously, intranet, emails, SMS, press releases, and we do use our HR portal in the company, because at the end of the day, the wellness department is under the HR function, and this shows the care that we do provide to our employee. And let me tell you one thing. A lot of organizations might mention that we really care about an employee and we concentrate on employee engagement, and they are our cornerstone, but when it comes to implementation, the integrity and the reliability of integration doesn't show up, and an employee would feel that, definitely. So it needs to be credible, and it needs to be genuine, directed to the employee. Innovative Ideas team, we were able to publish a survey and request employee to bring along their innovative idea, and we had more than 200 ideas for the same. And last but not least, our wellness smartphone application. That also I'll show you a quick glimpse of it. And just maybe for the sake of time, and to allow you ask questions, I'll cruise quickly through a couple of the coming slides. This is a picture of myself with one of the patients in the clinic down in the headquarters of the company. This is our intranet website, a dedicated website for the clinic with health tips and some medical updates. This is the staircase area and the elevator, which I have mentioned in my previous slide, and you can see nice quotes which encourages you to use the stairs, and that how many number of calories you will be burning if you use the stairs, whether it's in the corridor or the elevator. This is a slide which gives us a snapshot of the smartphone application. By the way, if you have an iPhone, just go onto the Apple Store and type in DU space wellness space app APP, and then you will see our application down there, and it's free. You can download it, and it connects to various wellness devices such as the Jawbone or Fitbit devices, and then you can start putting in your activity, the number of calories burned, and this is a gift for our society because we do believe that it's not only the internal CSR, it's also the external part of it. And that was part of a national campaign which we launched in the last June called Every Step Counts, where we encourage society to move and to make small changes in their life, which is not the topic of our day-to-day. Maybe we can discuss it some other time. Results and outcomes. Just a nice picture that I like to show. This is our women winning the Women Run. And you can see the multicultural aspect in the picture where ladies from different cultures, from different ways are in harmony together. And that's something we really like to brag about in the company because it really shows the family spirit that we have. This is our winners of our first season of Weight Loss Challenge and how they looked before and how they looked after they lost their weights. And here they were being rewarded by our CEO. And again, this is a very important point to mention. Be rewarded by the CEO or by the senior management is a very, very strong motivational tool to ensure sustainability of wellness activities and to ensure that those people will come back to you again and they will be your marketing tool and your wellness champion. And we use the following measures of success, whether it's increase in participation rate or increase in number of activities year on year, whether reduction in the level of cost and claims. So it all depends on what indicators, but the most important indicator that we are looking at the moment is employee engagement and the participation rate, and the reason for, and the various health parameters which has been mentioned for the executives. The reason for that, again, because when it comes to medical insurance and absenteeism, there are other factors which act as a challenge, which needs a more number of years in order to be able to measure them, but we are working on them very closely as well. This is just a very quick glimpse of the number of the various activities in 2012 and 2013, and the number of participants increased in these various activities. This is a nice slide. It shows you about employee engagement and the increase in the percentage of employees. For example, 51% of employees reported that they are now more aware of their employee commitment to their health and well-being. So this was a report which was generated from the Global Corporate Challenge when we had our 2-year in a row participation with them and showed how employees were engaged in this specific activity. Reducing stress, this is one thing we all face on a daily basis, and especially work stress. So this is a slide which shows about the percentage of reduction in stress which our employee has sustained in their participation. Energy and vitality, this is another thing. 63% of our employees report the quality of their sleep to be either good or excellent, having participated in the challenge. And productivity, which is what at the end of the day the board of directors and company executive management look at, is how our employees are productive and how they are able to produce best. I do understand we are still in a very dynamic country where things changes very quickly and requirements of competition sometimes lead to stress level moving like a pendulum up and down, and sometimes it's not quite be stable. But at the end of the day, having the various tools that has been mentioned in terms of wellness will hopefully ensure that on the long run, we will have that kind of a cushion effect that if somebody gonna fall off, they're gonna fall off slowly and they'll be cushioned by our various wellness activities and by our wellness initiatives in order for them to pick up quicker and push the paddle again. In summary, it's a young field in the Gulf Corporate Council, the concept of workplace wellness, and as you can figure out, a small number of employers have the setup. And we need more studies and more statistics and research in terms of effectiveness. And the major current drivers is CSR, corporate image, absenteeism, productivity, And I would definitely like to add employee engagement is another strong driver which has been showed up more and more in the last 2 to 3 years in specific. And for that reason, we were even able to be rewarded the ID of the Year award in the health and safety sector by the Dubai Quality Group as our employee wellness to be one of the most innovative ideas. And that also gave us another kind of a protection cushion effect to go that we are on the right path, and that hopefully we will be able to change to make this concept more viral and make it more contagious to other organizations. And I would like to conclude my talk thanking you all for your listening. And this is again a nice picture about our participation in Dubai Marathon. We had more than 170 employees participating on that event, with our chief commercial officer even participating and completing the 10-kilometer run in 55 minutes. So that was really a good story to share to all employees. Okay, Wolf, back to you.
Yes, thank you so much, Dr. Mansoor. It's an excellent presentation, some really useful insight that you brought today. So I'd like to announce the opportunity to take questions. So please type in your questions in the Q&A box, and we'll pick them up as they come in. I would just like to add that the application for the Global Healthy Workplace Award, Mansoor, was I would say the strongest one out of the region. You know, given that we didn't receive that many applications from the GCC for the Global Healthy Workplace Award, but I should just add that it was definitely the strongest from the region. So that's also good. So I don't see any questions as of yet. And so Daniel, if you see any, let me know. But let me kick it off here. I think, well, first of all, I think it was an excellent description, and it's really, I think, innovative what you are doing in the region. So I think that, you know, maybe for any country in the world, this is a lot and a pretty good program, I think. So my question is, I know you mentioned you have good leadership support, so that's great. I mean, this question you probably get often, but what do you think was the trigger in terms of actually investing in a clinic, investing in programs? Was it the CEO, or was it another leadership person who really believed in it? Or was it just rising healthcare costs? Probably a combination, but what do you think was the actual trigger to kind of flip the switch to really go full bore and invest in employee health? What do you think?
Okay. I mean, from what I came to know once I joined the organization, there were two important factors behind this thought process to invest in this concept. Number one was the CEO, because our CEO has established a telecom operator company down in Egypt in 2004 by the name of Mobile. And he was there for a good number of years, or since 1999, if I'm not mistaken, sorry. And there in Egypt, I believe they have a mandate that there needs to be a company doctor if you have a number of X number of employees. And I remember one day I was chatting with him, and he said, you know what, when I saw that doctor sitting in the clinic in the company and responding to people's and to employees' concerns, and regardless if these concerns are health related or non-health related, I figured out how important is that in terms of employee engagement and in terms of taking care of our employee, that they have somebody who can listen to them from a different perspective, and especially when they're stressed out due to various reasons, as you know, the challenges. So he said, when I came down to Dubai, that idea was always there, and I said, we need to bring this in the company, and we need to have it. And he said to me, even from day one, I wanted to have that, but then it seems that the maturity was not enough, or there was no complete readiness, and they had other priorities at that time when the company was under construction and under establishment, and until it kicked off and it started picking up. So this is one. And the other factor is our chairman. Our chairman tends to be also the CEO of Dubai Holding, which is another major semi-government private organization in the city of Dubai. And Dubai Holding has a major portfolio in real estate, and like, for example, Jumeirah Group, the massive chain of hotels across the globe, is being owned by them. They have implemented a wellness program down in their company since 2007, actually. And they have recruited somebody in the arena of wellness since then. So he also had the passion for it. And by the way, I would like also to congratulate him because just 6 months ago, he himself did win a fitness championship competition in his age group, and he was the fittest person in his age group for that competition. And by the way, he climbs a 52 flight of stairs in 12 minutes. He participated in the Worksite Marathon 2 years ago. So, and he's an Emirati, he's a UAE national. So that's another good story to share. That, he had and what to far away. Tell you where does it stem from? It stems from our rulers. Our ruler of Dubai, Sheikh Mohammed bin Rashid Al Maktoum, he walks every day for a distance of 3 kilometers, and every week for a distance of 10 kilometers, and every month for 20 kilometers. This is declared by him in one of the government summits 2 years ago. He's a very, very active person, as well as his eldest sons, and they participate regularly in sport activities and horse riding. So it's a culture that has been cascaded down from his office down to Dubai Holding, and maybe that was another reason that it came to do in a much quicker format because he's the chairman of the company, and having the CEO, which comes with a background of that positive experience from Egypt, although he's French from Lebanon. So I believe these were the major catalysts to invest in wellness and to push the paddle. And I remember even when the clinic was ready to go live, he himself, the chairman, visited the clinic and looked at it. And even within a year's time, they have invited the Minister of Health to come and visit the clinic and have a look at it. So this shows the commitment which is there.
Yeah, very much so. That really drives home the point of leadership and senior management support. Excellent. That's very powerful. I have a question here from Marcy. Do you include spouses in your program?
Obviously. I mean, all the wellness calendar that has been mentioned in the slide, all of this is for the staff of the company. They are involved with the various, if I'm got the correct question right, everything which is being done in terms of the initiatives and activities is all toward our staff, and even to their family members. For example, our flu vaccine campaign is extended to the family members of the staff when we do that on a yearly basis. And also recently we have collaborated with a football academy, soccer academy, and we have subsidized rates for the children of our staff.
Okay, yeah, that was the question about family members and spouses, so wives and husbands. So, okay. I think you answered that question. That's excellent.
Yeah.
I have a question here from Kenya. I run a company that partners with organizations to set up wellness programs. Our biggest challenge is that most organizations in Kenya see setting up a wellness program as a cost instead of investment. What would you advise in your experience to change this mindset? So moving from a cost to more of a value kind of mindset. What would you advise?
Okay, it's a very good question, and it's a very challenging question. Again, if the mindset of the leadership, it is a cost, then it will be a cost. It will never be looked at as an investment. I think a good way to overcome that challenge is the employee themselves have to show that kind of a commitment. Because if I do launch a 1 or a 2 wellness event and the participation rate is very low, then that's an indicator for me as a decision maker that I told you, nobody's going to participate. See, and you want me to waste all of this money? If I'm speaking from behalf of that person who looks at it as a cost. Because they need a very quick excuse. They need a very quick blame factor. Here, you don't need to give them that opportunity, and I think participation from employees themselves should be very high initially to get that buy-in, and then it becomes sustainable. Or in another hand, for those members or employees to participate in external events and try to win these external events and become ambassadors and to become famous maybe in the press releases, and then they will figure out, oh my God, okay, this is a good opportunity for us also to market our brand or to market our company. I know it might not sound the right way of doing it, but again, this could be one way to look into it, because again, for the leadership, if they're not much interested in that, but if tomorrow they saw their employees are participating and the logo is showing up in different events, then that might catch their attention.
Okay, great, thank you. Another question. Does each employee receive one-on-one wellness counseling as part of your program?
It's always there. It is not something a mandate, but anyone who would like to go for it, the doors are open of the clinic. In addition to that, we have collaborated with counseling services down in Dubai with a subsidized discount so that employee can visit them whenever they need. So, because let me tell you one thing, employees still are skeptical about visiting a wellness advisor in the company, because still we have that challenge in a good number of organizations that if you're not fit or if you're sick, I might not renew your residency first, or I might not recruit you in another organization, because we have this rotating worker structure and challenge in the region, which might not be similar to other parts of the world. So still people are somehow hesitant, because ironically, when we established the clinic in 2010, at that time we were still within the turmoil of the financial challenges in the country and in the whole region, the globe. And a good number of employees thought that the reason of having a clinic is to figure out who is fit and who is not fit. So they were not showing up for the first few months until they figured out we are there to support them, to help them, to push, to go the extra mile, and that even if we have a sick leave policy which tells only 90 days in a year, we can go up to a full-fledged support, unlimited, because we believe in our employee and they are our greatest asset.
It's a good point, Mansoor. I think that thinking that they're afraid to disclose personal information and then participate because of maybe to lose their job, that isn't existing in other countries too. So you have to gain their trust, and it sounds like you've done a really good job doing that. Gaining their trust and running the program. Let me take one more question because I know we're close to the top of the hour, and it's about the smartphone app. Was that something that is already pre-existing, or did you have it designed specifically for your company? I guess you can explain that easily.
Yeah, no, actually, this has been designed specifically for our company. I mean, what happened when His Highness Sheikh Mohammed spoke about the physical activity portion of his lifestyle at the government summit in 2012, so our company decided in 2013 to invest on this wellness app and to provide it as a gift for our society in order to foster the culture of wellness and the culture of physical activity on their daily life. So we brainstormed and we laid down a couple of various ideas, and we thought, okay, what is the best way and what would make our application different than other applications which are in tens and hundreds in the App Store, and why would people pick up this specific application? So here we thought, okay, we will collaborate with existing fitness providers such as Fitbit and Jawbone, and to use their trackers, to use our application to feed in the data, so then you don't need to invest even on a wellness device, so it's just the application. And another one thing we did when we developed this application from zero, obviously, the database which we used for our dietary component, we have also involved local food, so that we figured out from our local institutions what are the calorie content of our local food as a UAE nationals, which we have in various ceremonies. We have also included that in the app so that it is more local culture, custom made, rather than just a generic international kind of thing, in addition to the international cuisine as well, obviously.
And could you repeat the link one more time? Because I had that question for the wellness app.
You just go to the application store of the iPhone, the App Store, and then type in there do, as in DU, as one word, space, wellness, WELLNESS, space app, AWP, and just click on the search icon, and then you will see it in the drop-down menu in the application store. And you can see the logo of the company, and you can just download it for free.
Excellent. Thanks so much again, Mansoor. This has been really useful, educational. I should mention that we are in the planning stages to do a seminar and featuring for early next year, and we'll keep you posted. This is aligned with the Healthy Workplace Award program. So I really look forward to making that happen. And I know Mansoor, we've talked about that, and I think we can make it happen. So again, thanks to you, of course, especially also because it's a late hour for you. And then thanks to everybody for participating. Really, really useful and very enjoyable. And just to repeat, the webcast will be available in audio form. So for those of you who missed part of it, you can listen in afterwards and catch that. And the Corporate Health and Wellness Association will be emailing everyone within about 48 hours. So also on behalf of the International Association for Worksite Health Promotion, I'd really like to thank everybody. And again, a special thanks to Dr. Mansoor. And so that's it. Thank you, everyone, for joining today, and have a great rest of your day. Thank you very much. Bye-bye.
Thank you, Wolf and Daniel. Bye-bye.